If you're diving into the world of regenerative medicine, it can literally feel like the Wild West. One clinic offers you a certain number of cells, and then another one swoops in offering triple that amount for the same price. It is incredibly confusing. So today, we're going to deconstruct this whole complicated world of stem cell dosage, look at the actual hard data, and equip you to navigate these treatments like an absolute expert. Let's dive in.
100 million. Just take a second and look at that number. It's massive, right? It's super impressive, and honestly, if you're scrolling through marketing materials for a stem cell clinic, it's a number you might see plastered everywhere, in bold letters. It sounds so incredibly precise. It feels like you're getting this huge, unbeatable amount of value. But I want you to hold on to a thought as we move forward. That number, just sitting there on its own, tells you almost nothing about the actual medical treatment you're about to receive. Which brings us to our central question, and honestly, the biggest myth we need to bust today. Does a higher cell count automatically mean a better treatment? The short answer is absolutely not. Human studies simply haven't shown a pattern where just pumping more mesenchymal stromal cells, or MSCs, into the body consistently leads to better results. I mean, it's not like putting more gas in your car to make it drive further. Human biology is way more complex than basic math. And this kind of shatters that whole illusion of precision, doesn't it? When a clinic just throws the phrase 100 million cells at you, what on earth are they actually measuring? A truly meaningful stem cell dose has to have context. Are we talking about cells per joint? Cells per IV infusion? Is it carefully calculated by your body weight in kilograms? And crucially, this is huge, are these viable living cells or just a total count that includes a bunch of dead ones? Or maybe it's a cumulative number spread across several visits. Without that context, a flashy headline number is just meaningless. So let's break down the actual difference between mere quantity and living effective quality. Think of it like this. Cell count asks, hey, how many cells are in this vial? Viability goes a step further and asks, okay, but how many of those cells are actually alive? But potency, and this is the real game changer, potency asks, does the cellular product actually perform the biological activity it's supposed to do? You could have a billion cells, but if they aren't viable or potent, they aren't going to help you. Quantity simply does not equal clinical effectiveness. And this perfectly illustrates how real regulated medicine handles stem cell dosing. Let's look at Ryoncil, which is the very first FDA-approved MSC therapy in the United States used for a specific pediatric condition. The FDA label doesn't just broadly say give the patient 50 million cells. No way. It mandates an incredibly precise, calculated dose, exactly 2 million MSCs per kilogram of body weight, given via a specific IV route on a very defined schedule. It's calculated science, not some marketing race to see who can advertise the biggest number. Let's bring in the scientific receipts, right, from actual human trials. If you look at the Lamo Espinosa trial for knee osteoarthritis, right there at the top, researchers tested 10, 40, and 100 million cells. And the result? Long-term outcomes were actually quite similar across all those doses. 100 million wasn't some magic bullet. And looking down the table at the Mata study, human research just flat out does not support a universal, more is always better rule. Actually, let's zoom in on that Gupta study for a second, because it is fascinating. They took patients with knee osteoarthritis and gave them varying doses of allogeneic bone marrow-derived MSCs, ranging from 25 million all the way up to 150 million. Now, if the marketing hype were true, that 150 million group should have won by a landslide, right? But they didn't. The strongest trend for improvement actually showed up in the 25 million cell group. A dose literally 6 times smaller outperformed the massive blockbuster dose. So the crazy thing is, pushing too many cells into one localized area isn't just a waste of money. It can actually cause adverse reactions. There's a concept in medicine called a therapeutic window. In a recent 2024 phase 1 trial by Matas and colleagues, patients received 2, 20, or 80 million umbilical cord-derived MSCs in a 3 milliliter knee injection. Guys, every single patient in the highest dose group, the 80 million group, experienced injection-related knee swelling. Every single one. Meanwhile, the lower and moderate doses actually produced greater clinical improvements.
Now, you might be wondering, okay, so lower doses are just always better, right? Well, no. It completely depends on what you're actually treating. For knee osteoarthritis, a network meta-analysis showed moderate doses of 20 to 50 million cell often rank best for those long-term outcomes. But contrast that with the heart disease data on the right. In the Trident trial for ischemic cardiomyopathy, a 100 million cell injection actually outperformed a 20 million cell injection. Different condition, different cellular environment, different optimal dose.
And here's another curveball. It's not just about the total number of cells, it's about how and when you get them. Timing is everything.
let's look at treatment scheduling. In another trial, researchers compared giving patients a single 40 million cell injection versus giving them two 20 million cell injections spaced 6 months apart. The repeated dose group, the folks who got 20 million twice, achieved stronger results for pain and function at 12 months. So 40 million given once is biologically a very different thing than 20 million given twice.
All right, let's put all of this into a real-world scenario. Imagine you're out there clinic shopping, and you've got these two proposals sitting right in front of you. Protocol A advertises 30 million MSCs. Protocol B advertises 100 million MSCs. Now, if you're only looking at the biggest number, Protocol B looks like a way better deal, right? It's more than triple the cells. It's like the ultimate bulk discount of medicine. But let's look at the fine print that actually matters.
Because when we actually connect the dots, the whole picture flips. Protocol A is 30 million cells per treatment, across 4 treatments, injected directly into your joint, with viability fully disclosed. Do the math, that is 120 million targeted cells over time. Protocol B, on the other hand, is a one-time total of 100 million cells given via an IV infusion, where they're just going to circulate through your whole body, and their viability isn't even clear. By looking past that shiny headline number, we see Protocol A might actually be a vastly more robust and targeted treatment.
And guys, this is exactly why you need a structured way to evaluate your options. It's why I am so excited to talk about the STEMCIERGE protocol comparison tool. It is an absolute game changer, the ultimate equalizer for patients. Instead of getting dizzy comparing apples to oranges, you literally just plug in the details from 2 clinic proposals. You enter the cell count, the tissue source, the administration route, and whether they disclose viability and human evidence. It strips away all the marketing fluff and shows you the actual medicine. Once you plug your info into the tool and see those gaps in a proposal, it totally empowers you to ask your clinic the really tough questions. Don't just ask, hey, whose number is bigger? Ask them, what exactly are we counting here? Are these viable cells? How are they being administered? Why was this specific dose selected for my exact condition? And what human clinical trials actually support this strategy? A reputable clinic will be absolutely thrilled to answer these questions and explain their clinical rationale to you. So what is the big takeaway from this whole explainer? You've got to start comparing stem cell treatments as complete, holistic clinical protocols, not just as price per cell marketing packages. The cell count is just one single variable, alongside the physician's expertise, the cellular product itself, the administration route, and the supporting evidence. There is simply no universal magic number of stem cells. The right dose is the one backed by a sound, scientifically proven clinical rationale.
We've covered a ton of ground today, from the illusion of that 100 million cell headline right down to the science of therapeutic windows. You are no longer just a passive patient. You are a focused, informed learner ready to take charge. So I want to leave you with this final thought. Next time a clinic promises you a massive, impressive sounding number of stem cells, will you know exactly what to ask them? For sure you will. I highly recommend checking out the STEMCIERGE protocol comparison tool to help guide your next steps. Keep asking questions, keep demanding evidence, and stay curious.